Our top stories this Saturday are out of Washington. At the top of the hour, you heard early reaction to the Senate Republicans' health care proposal. Of course, we've been following that all week. And we're getting new perspective from the other side of the aisle this morning from one of our Indiana lawmakers. Indiana's Democrat in the Senate, Joe Donnelly, is stopped by the Daybreak studio. Thank you so much for spending some time with us.
Thank you.
So you released a statement just a couple of days ago, right after the proposal became public, and you're really calling for bipartisanship here.
I am, because we'll get such a better result. My friend and colleague, Republican Senator Dean Heller, yesterday said, I won't support this health care bill because it ends coverage for millions of Americans. Well, we can put together really good health care that'll keep premiums low, deductibles low, as long as we take good ideas from both sides.
So we say both sides need to work together here, but
right.
What do you do personally to work with your colleagues?
Well, I actually met with the only meeting we've had of Democrats and Republicans on the health care. I was part of that meeting. We came up with a number of really good ideas, and none of them were included in the bill. And so what I'd love to see is to take some time, have everybody get together, talk to our doctors, talk to the patients who are affected by this, because they're on the front lines. We're trying to put legislation together, but they live it every day, and we need their perspective as well.
What are you hearing from the people you represent, and how are you responding to Hoosiers on this topic?
Yeah, the concern is about all the Hoosiers who will lose coverage. And so a couple 100,000 minimum will lose coverage. We have HIP 2.0 will end. For seniors, or for Hoosiers between 50 and 64, what happens is your rates go through the roof. And so health care, in effect, becomes unaffordable. And for people with pre-existing conditions like diabetes or cancer, multiple sclerosis, what happens is you can get health care, but it won't cover your pre-existing condition. And so, in effect, you don't have health care.
This has made headlines in so many different ways throughout the week, of course. And we saw here locally, Anthem and MedWise pulled out of the marketplace for Indiana for next year. What was your reaction to that, and how does that all relate to what's currently happening?
Well, the cause for that is that the administration has refused to commit to make what are called cost-sharing payments. And those payments have been there for years, and they keep premiums low and deductibles low. And without those payments, the health care programs, in effect, become unprofitable for the insurance company. So if Anthem and MedWise had assurances that those payments would be continued, then they would have stayed in the pools.
All right. Well, another newsmaker this week is the president's call to reform the Department of Veterans Affairs. This is something you voted in favor of. Why was this an important issue for you?
Well, the vets are the ones who saved our country, who have given us the freedom we have. And what we're trying to do is make sure that the VA system is the very, very best in the world. And what this bill does is, for folks who have good ideas, whistleblowers in effect, that for saying, look, this system's not working right, maybe you want to try this, that they don't get punished, or they don't get suspended, or they don't get terminated, that we protect those people who come up with good ideas for us. And then secondly, for folks, 99.9% of the folks who work at our VA work really, really hard and do a good job. For those who don't, this gives us the chance to have them go in a different direction.
All right, Senator Joe Donnelly dressing down for us, coming in on a weekend to talk. Yeah. What else why are you back in town? Why are you home?
I'm going to be at the Freedom Festival down in Greenwood here in a little bit, and just being around town.
Okay. Yeah. Senator, thank you so much for your time this morning.